Exclusive breastfeeding, 0 to 6 months. During the first 6 months of life, breast milk fully meets your baby's needs. It nourishes, hydrates, protects against disease, and strengthens your bond. In a country where safe water, safe foods, and access to healthcare can be limited, exclusive breastfeeding, that is, only breast milk, with no water, herbal teas, sugar, or other milk, is one of the most effective, affordable, and available protections for infant health. International programs recommend starting breastfeeding within the first hour after birth, using skin-to-skin contact, avoiding any supplemental bottle, and continuing exclusive breastfeeding up to 6 months. These are pillars of the Baby-Friendly Hospital Initiative, BFHI, supported by UNICEF in Afghanistan. Why does exclusive breastfeeding save lives and support optimal growth? Breast milk contains antibodies, immune cells, and factors that seal and mature the newborn's gut, clearly reducing diarrhea and respiratory infections, two major causes of illness in babies in low-resource settings. Studies show that breastfeeding support significantly increases exclusive breastfeeding and reduces diarrhea in infants. Starting breastfeeding early is crucial. Cohort studies in Asia have shown that initiating breastfeeding within 24 hours, and ideally within the first hour after birth, reduces the risk of neonatal death by 44 to 45%. In Afghanistan, where infections, winter cold, and food insecurity are frequent, exclusive breastfeeding also protects against risks from unsafe water and inappropriate foods. Finally, breastfeeding on demand promotes bonding, soothes the baby, stabilizes body temperature, and helps naturally space pregnancies through lactational amenorrhea, when certain conditions are met. Technique matters a lot for pain-free and effective breastfeeding. Sit or lie down comfortably with your back supported. Bring the baby close to you, tummy to tummy, with ear, shoulder, and hip in a straight line. The baby's nose should be level with the nipple. Support your breast with your hand in a C hold, thumb on top, fingers underneath, without pinching the areola. Let your baby open his or her mouth wide and bring the baby to the breast, not the breast to the baby. A good latch is recognized by a wide open mouth, flanged lips, especially the lower lip, the chin pressed into the breast, and regular swallowing without clicking sounds. You should feel a tugging sensation, not pain. If it hurts, slide a clean finger into the corner of the baby's mouth to break the suction, then reposition. The most practical positions, including in everyday Afghan life, are the cradle hold, easy to use under a shawl to preserve modesty; the football hold, useful after cesarean section or if breasts are large; the side-lying position, comfortable at night, useful in winter to keep warm; and prolonged skin-to-skin under a blanket. Feeding frequency is another key to success. Breastfeed on demand day and night. Watch for early hunger cues, baby waking, searching for the breast, bringing hands to the mouth. It is normal to breastfeed 8 to 12 times per 24 hours in the first weeks, sometimes more in the evening. Let the baby finish the first breast. The milk at the end of the feed is richer in fat and more filling. Then offer the other if the baby wants it. Even in summer or in dry climates, do not offer water. Breast milk hydrates perfectly, and introducing liquids reduces time at the breast and milk production, while increasing the risk of infections. Night feeds support milk production and weight gain. In Afghanistan, where nights are cold in winter, feeding in bed in the side-lying position helps keep the baby warm while breastfeeding. If difficulties arise, simple solutions exist and are best implemented early. Cracked nipples most often come from a poor latch. They can be prevented and corrected by adjusting position and latch, changing positions, gently taking the baby off the breast, using a finger to break suction, and spreading a drop of breast milk over the nipple after feeds, letting it air dry. Avoid using soap on the nipples. If pain persists, or if there is fever or pus-like discharge, consult a midwife or health worker. Engorgement, Breasts that are hard, tight, and painful occurs when the breast is not drained enough. Breastfeed more often, check the latch, and gently massage from the chest wall toward the nipple. Before a feed, gentle warmth, a warm cloth, and expressing a little milk by hand will soften the areola. After the feed, if the tightness persists, express until comfortable and apply something cold for a few minutes. If you have fever, chills, and a painful red area, mastitis, seek care quickly. The feeling of not having enough milk is common but usually unfounded. The best response is to increase feeding frequency, use skin to skin, and improve the latch. Signs that a baby is getting enough milk include at least 6 very wet nappies/diapers per day from day 5 onwards, soft yellow stools, regular weight gain, and a baby who is alert and satisfied between feeds. Where water is unsafe, exclusive breastfeeding protects against diarrhea because it avoids exposure to contaminated water. Only a minority of children aged 6 to 23 months in Afghanistan receive enough food in adequate quality and quantity. In winter, skin-to-skin contact and frequent feeds help maintain the newborn's temperature. The costs of breast milk substitutes are high and preparing them safely is difficult. Breast milk is always ready, at the right temperature and free. Family norms matter. Explain to your husband, mother-in-law, and elders that giving water, tea, or animal milk before 6 months reduces milk production and increases infection risks. Ask them for concrete support, preparing meals, fetching water, helping with older children, so you can breastfeed on demand. If you need to travel or work, breastfeed just before leaving. Use a shawl to breastfeed discreetly. If needed, learn to express your milk by hand. Without refrigeration, that milk should be given quickly, ideally within 4 hours if the temperature is moderate, in a clean cup. For small babies or those born too early, kangaroo mother care, continuous skin-to-skin, frequent feeds, monitoring for danger signs, reduces mortality and improves breastfeeding, can be done at home as well as in health facilities. Finally, let's address some common myths. Babies need water in summer. This is false. Breast milk covers all water needs, even in very hot weather. My milk is too thin. Milk changes over the course of a feed and over the day. If your baby feeds effectively and often, your milk is sufficient for 6 months. Herbal teas calm colic. Not recommended before 6 months. It is better to improve latch, help the baby burp, and use skin to skin. On your side, drink according to your thirst, clean water, broths. And eat a varied diet with local foods, grains, lentils, vegetables, fruits, dairy products, eggs, meat/fish if possible. Rest and family support are also food for your breastfeeding. Exclusive breastfeeding is a powerful, immediate, and free investment in your child's health. With good positioning and latch, frequent feeds, skin to skin, and the support of family and well-trained health workers, you give your baby the best possible start. In Afghanistan more than elsewhere, it is a gesture that protects and saves lives.